Okay. Ms. Monica, I want to ask you about the technique, the mechanism of action of the laser, which will affect the vessels, especially I want to know what's the difference between the conventional types of laser and the multi-slice type of laser. In consideration with the patient is asking about this knowledge several times, and the patient with the old experience related to the diabetes mellitus know definitely the difference between the laser of old technique and the laser of recent technique. I expect this.
Yes, I'm going to answer, of course, with pleasure. First of all, we have two different treatments. So we have a focal and grid treatment in the central part to improve the central vision. And in the coming slide, we will see what we do. And the target of the treatment is to stimulate the tissue to recover, to improve the different functions. And in this case, we just light a few spots around the central part called the macula.
Yeah.
And another treatment that is on the most of interest of us and which is taking the most time and is the most popular for our patients is called PRP, pan-retinal photocoagulation. And what does it mean? Yeah? The patient will ask, what does it mean? It actually means curdling the vessels with the help of the laser, of the light. So photo is the light, coagulation is the curdle. So on this picture now we see the treatment for the central part. And on the next picture soon
which is important, very important part in the retina.
It's a very important part in the retina. As you can see, there is the open part between the spots. This is the called fovea, and we do not treat it.
Yeah.
And the another part is the out of this area, and it's called, as I said, pan-retinal photocoagulation. I hope that to see it soon, that you can see. And those treatments are both required for a patient that suffer from the diabetic retinopathy. I think that Dr. Badawy agrees with me.
Yes.
So now we can see the picture of pan-retinal photocoagulation, and on the picture we can see how many spots we have to deliver to the retina. All the retina or the eye is covered by the laser spots.
Okay.
And before, we really treated very, very properly, I would say. So we deliver a very big burns. So answering your question, so what is the difference between the conventional treatment?
It occurs in the last few years, in the past.
Yes.
Yeah.
It's still used. It's still used. It's actually used in the most
in spite of
most of the clinics doing that
this
now.
burn damage which will occur as a result of this treatment?
It's the target of the treatment is to stop the disease, not to become worse. But there is lots of side effects, and I believe we are going to talk about it in a moment. But the most important is that the big difference between treatments and conventional laser, which as Dr. Badawy mentions, it's used by many, many clinics.
Okay.
So it's a common, the most popular treatments cause a big burns, a big damages. So we stop the disease, but we never became better.
Okay.
And we actually make some losses. So to become better, we gain and we lose. So instead of making the big black spots we are going to see soon, with a new technology, we deliver barely visible spots that stimulate the tissue, that reduce the number of photocoagulators, that improve the processes. My Arabic is not existing, but I understood that you mentioned VEGF.
VEGF, yes.
Yeah. So we are actually trying to add, this is like another treatment. We can have an injection, we can have a laser. Yeah? So we stop the factor that grows the vessels.
Okay.
And on that picture, on the left, you can see the standard treatment. You can see the big black spots, yes? Those are the burns delivered with conventional laser, with conventional settings.
Okay.
On the right, you can see the burns delivered with, actually with laser produced by our company. You can see barely visible light spots, perfectly delivered.
Mm-hmm.
So what is the target? You can see, instead of damaging, we try to stimulate. So we've hopefully finally found how to stimulate the process, how to damage the minimal.
Okay.
So how to reduce number of photoreceptors, improve the vision.